So hello there and welcome. My name is Tyler Vest and I'm one of the Springboard community managers. Today's webinar, Community Voices, Ensuring Community is at the Heart of SBC, is presented by Springboard, an online community under the Breakthrough Action Project. Breakthrough Action is USAID's flagship program on social and behavior change. It ignites collective action and encourages people to adopt healthier behaviors by forging, testing, and scaling up new and hybrid approaches to SBC. If this is your first Springboard webinar, then welcome. So what is Springboard? Springboard is an online community of over 5,000 SBC professionals from over 100 countries. Springboard can help you advance your SBC skills, connect with colleagues and SBC leaders, and get inspired through resources, events, and jobs. If you're not a member already, join today. So we'll be starting today's event with 3 presentations, followed by time for questions and answers. Feel free to use the chat feature on the bottom to introduce yourself and your organization. Additionally, you can use this feature to ask any questions for the speaker throughout the event. We'll compile those to be able to use during the Q&A session. Now on to the show. So our first speaker today is Barbara Davies, and she comes to us from Infinity 970 in Ghana, where she's the executive director. Over to you, Barbara.
Hello, everyone, and thank you, Tyler. So we're talking about how to keep community voices at the heart of SBC. And in our view, it starts from the beginning through to the end, and is hinged around a few pillars: acknowledgement, understanding, representation, and feedback. So to start and to ensure that the community is at the heart of it, we have to examine the intervention. What is the change that is required? Who does it matter to? And where will the community be after the project? So you have to ask, has the community made a request of you? Have they asked for a particular change? What are the perceived benefits they hope to get? Or is it you who has a suggestion? And if it is that you are the implementing partner or implementing body and it's a suggestion, then you have to be open to the idea that it may be accepted, ignored, or rejected. Because if social behavior change is about opening new pathways to communities for progress, then the community has to be at the center of it. They must want that progress, and they must be a part of the defining and the shaping of it. So when I come to acknowledgement, what we're saying is you have to acknowledge that progress is a universal human need. So no one community sits and decides, we are not going to budge, even if this is not helpful to us. As human beings, we are hardwired to stop doing things that we don't think is taking us very far and to adopt new changes. So when the community is there and they are doing things the way they do, then there has to be a reason they are doing it, because it's working for them. Maybe reasons you are not privy to just yet, which you will find out in good time. Also, to acknowledge that what is good for the goose is not always good for the gander, because again, like I said, progress is a universal desire, but maybe your particular shape of it or form of it is not quite what the community wants. So you have to go to the community and find out what lies at the heart of that community. What we will say in brand building will be, what is the brand essence? And that will be the guiding principle. So to make sure that what you do has the community at the heart, you have to understand what lies at the heart of a community. What is that community essence? What do they desire? What would they rally around? And what would they push forward? This calls for understanding of the community, because what you have to also acknowledge is that no one data source can unpack all the community nuances. The only way to know a people is to be with a people, to observe them, to understand why they do things, and to understand where they are going with the things they do, because sometimes there are impinging factors. You touch one aspect of a community life with an intervention, and it's got ramifications on other pillars. And therefore, immersing yourself in the community, observing and doing with, and having them open up to you, or you getting a better, richer understanding, helps you better fashion the way you think your project might go and the expression of it. It's also understanding that there are 9 ways to skin a cat. So maybe the objective of the project is not the issue so much as the formulation of it. So projects must come with enough latitude to allow for room for expression and incorporation of ways to make them richer. I will take an example of family planning. And the first family planning project I was a part of was when I was in university. It feels like a lifetime ago. So I keep wondering, why do we keep coming back to this issue of family planning? And then you realize through one of the community interactions and immersions that it is the understanding of what we call a large family. To some communities in our part of the world, large families are wealth. So the more, the better. It is wealth, it is protection, it is stature, it is a voice at the table. It means so much. So when an intervention is defined very narrowly, projecting a family size of 2.1, then it starts feeling not in tandem with the community essence and what family means to them. So in that case, the notion is listened to, but never adhered to, because the expression or the formation of the idea and the implementation of it don't quite work together. A few other things come to mind on this understanding of community and the fact that projects have to allow latitude to make room for different expressions and implementation things. It's also understanding that when a project, well, again, in the fashioning of it, how much time have we got? How much budget is put to it? What are the measurable objectives we've put in place? To put the community at the center, all of this will have to be discussed, agreed, and worked out with a community of people. And in this case, the community of people is not just the recipient community at the end of the intervention. It's all the stakeholders you work with and through along the spectrum, because you will work with agencies on the ground. They will be community. How is your voice being reflected in the design of the project and in the expression of the project, which then brings us to representation. How is everybody represented at this table? So we will talk about focus group discussions. Yes, they will unearth a lot of community insights. They will give more depth to the ideas we want to push forward. Community immersions, as I've said, so you can understand and get first-hand knowledge. And in this thing as well, we went to the north to work on a children's program. And we weren't getting much traction till we saw an old monument, a heritage site, and we took an interest and started conversations around them. And that gave us a breakthrough opportunity, because what we found out after the fact is that to people in some parts of the north or in different communities, Southerners are very individualistic, looking out for their own interests. And therefore, we were strangers in communities that we thought we were a part of. But we had to understand that to gain traction and to gain trust, we needed to find common ground. So this is what community immersions bring out. and stakeholder engagement. I know we're in a digital age, and sometimes we find different forms of stakeholders, the influencers, they are the key opinion leaders. Is understanding what each stakeholder community brings to the table, including the agency. What do they bring to the table to make the design, the expression, and implementation of the project good? And this is through engagement. In the design, we met Warren Parker a few years ago in our first experience of action media, and it was fantastic. How do you co-create? How do you sit with a group of people? Again, with our children's program, for instance, we've all been children before, but we were children decades ago and life has changed. So we can't pretend to be talking for children. So to do this, you have to ensure that children are at the table. Children are walking you through a day in their lives, the things that matter to them, the insecurities, the way they think the subjects will be expressed, better to have them involved. So this co-creation, whether you do action media, whether you, whatever, you have to have everybody on the table. It is only after this that you then go and do your pre-test to ensure that whatever you've come up with works. And then the other critical thing is your team composition. Again, our experience when we were working on You Equals You, or even on the MSM projects, is to say that as a community of people creating this, we do not represent the community we are speaking to. So how do we bring that community to be a part of our team? So we will see things through their lens and be able to implement. So again, we went into a community talking about no cutting projects or objectives and things too finely. And we do understand SBC is about verifiable facts. It's about things you can substantiate. It's about what was the term? Yeah, there's evidence-based, and therefore things cannot be open-ended. But by the same token, to get the richness and the latitude to make an impact is to look at adjoining pillars. We did some work on educating girl child, and to all intents and purposes, from the data existing, girl children don't go to school often or fall out and things, and therefore the project was designed around encouraging parents to support their daughters to go to school. We went on a consumer immersion just 45 minutes outside of the capital. We didn't even have to go far. And you find the ramifications and the adjoining pillars that this project was hinged upon. So what happens? The parents we were talking to themselves hadn't been to school before, did not understand the task they were supposed to perform, were not supportive of their children in the various ways that they could be, and therefore were becoming an embarrassment to their children in school when they turned up for PTAs and things because they were not plugged in well. You couldn't talk to the children directly because children have caregivers and caretakers. But in trying to address this one issue of a girl child going to school, you find out that it will require other pillars of social systems and structures to be addressed and worked on in tandem for it to make an impact. So again, this focus group, community immersions, co-creation, and all of these come together to ensure that whatever you're doing, the community is at the heart of it and they will take it forward after. Because the thing to bear in mind is you're here for a period, running an intervention. The community will be left with the implications and the aftermath of whatever intervention is put out there. And therefore it's important at the beginning, middle, and end to have them there and to go back, which is feedback, after the project, to go back and let them know, this is the impact you made, this is how their input helped make the impact. This is where you have come to. This is where you think that you might carry things on going forward, so that they feel involved in the whole process, rather than you finish an intervention, you go, they don't know what happened. A few years after, you come again and you start talking about it again. However, we do acknowledge there are challenges, and the challenges are budget, timelines, the multiplicity of the issues that have to be resolved, misaligned ambitions across different sectors and all of that. And again, like I said, impinging factors beyond the project scope, ability, and or capacity. But the way, again, to possibly overcome some of these budgets is when the concept, the idea, involves a community from the start in the definition of the project and in the possible ways it can be implemented. Some of these, if not all, can be overcome. So again, opportunities, start of the common ground. We all want progress in this life. How is the progress you're after, and how can we come in to help define it and make it better? We also have to be humble to know that no one team has all the answers. So we are all here to learn, to create bridges for each other to move on. And that feedback is essential. If you ask me to show you the direction, please have the courtesy to come back and say, oh, that direction took me where I was going. Thank you very much. It opens the doorway to trust and bigger opportunities for the future. So these are just a few examples of the things we've done. Doing Read for Life, which is giving children an opportunity to make their voices heard. Again, like I said, we are not children any longer, so we bring them in-house to help us formulate the ideas and plan and go into the community with them as a part of our team. Yes. And again, this is so embarrassing. However, when we run the ODF campaign, this is what some of the community thought will trigger a behavior change when people are so embarrassed to be seen as doing this. And the good thing about this project was we had an element that was swift to the post. So it went around the communities, telling them which communities were actually making changes or moving quicker to the mark. And that instigated other communities, because you found out the trigger is we don't want to be left behind. And therefore, if community A can do it, then hey, we better get up and do. And the other good thing UNICEF did was they teamed up with SNV, where they provided opportunity to get funding to create the toilets or build the toilets in individual homes. So you see that it's not that people just think, let's go and defecate in the open. If the adjacent need was the means to have facility at home, then how can we build relationships or partnerships to ensure that we are working together for the common good? Yes. Yeah. So thank you very much. And these are our key pillars for ensuring community is at the center of what we do.
Thank you. Thank you so much, Barbara. Moving on to our second speaker, we have Kenneth Mulondo here. He's a director and a lead consultant at the Solutions for People organization in Uganda. So over to you, Kenneth.
Thank you, Tyler. Thank you, Barbara. I would start off by giving a couple of examples of experiences from the field, which are basically stories. You could move to the first slide. So the first slide is an experience from ICANN, which was an integrated community agriculture and nutrition. It was a resilience program. And in this resilience program, we wanted to be able to build resilience capacities. So we depended on things like early warning signs. Now, for this particular one was, we got an early warning sign of an upcoming drought. And we quickly wanted to get the district level prepared for this and to be able to engage the communities. When we went out, the district officials were quick to tell us that we can't really take your information regarding this upcoming drought, because in the community, the elders, this is Karamoja region, the elders have the ability to forecast the weather by looking at intestines of a goat. And that was a dilemma, because we have within our donor projects, this is not acceptable. We will buy the goat, and how shall we be able to have this goat provided? How shall we believe the goat intestines? So we had to come to a compromise, because the district officials were saying, we cannot do this because we shall be fired from this district in case we're wrong with your information. So through community engagement, we actually tried to trust the community, and we listened to their voice. And the goat was actually slaughtered. And when they looked at the intestines, they agreed that a drought was coming up, and they were able to respond with the planting of early yielding crops. The takeaway was that where do we have that middle ground, and where do we learn from the communities, and how far do we go with our listening? At this point, we were lucky, and it was true when I came back to verify with veterinary officials.
Let's see, have we lost Kenneth?
Yes, I also can't hear him
What
from my
about
side.
that?
Let's see, Kenneth, are you there again?
I'm back. I think
Okay.
I'm traveling through. There's a challenge with the internet. You can move to the next slide.
Okay, great.
Hello, you moved?
Yes, when Ugandans ate soil is the slide we're on.
It's not here on my side. So I'll tell you the second one. So the second one is again when Ugandans ate soil, and this was a story in 1989 when HIV was salvaging everything that we had believed in, and Ugandans were dying from HIV/AIDS. I think the prevalence rate was about 30%. So people were desperate for solutions. And at that point, there was a lady called Nanyonga, about 60 years old, in a district called Zimbabwe, who came up with a miracle and said she had a miracle cure for HIV. And this solution was basically you eat soil that she provides, and people thought they would get healed. So what our thinking is that people from the urban state, from Kampala, which is the capital city, wouldn't believe this, but the traffic on Masaka Road, which heads to Zimbabwe, was a mess. People were heading out to eat soil, and it was recorded that about 45 tons of soil were eaten, and people were thinking of a solution, and this went on for a long time. But government did not intervene. Now, these were communities taking charge of a problem, and there was no intervention from government. A top-down kind of thing hadn't really come through. Until some point, the doctor then, the Minister of Health, Dr. Zakaheru, came out and said, this should stop. And we can't have our Ugandans eating soil with no results and people actually dying, and there's no change. So there was again a way we need to curtail what actually people believe and what they do in terms of solutions. So this was just a case where the community got it wrong, and we had 40 tons of soil eaten by HIV positive patients. So that was one challenge of listening to the voice. So there's an up and a good side and a bad side. This was a bad side. Now I'll go on to share what happened. You could move to the next slide. I'll put out these principles, and these principles Barbara has hinted on. These are the Howard principles that he put out, and these principles are basically people must see a reason for change. So when we come with our programs, at times we are wrong, and people actually have a way of doing surviving and having something fixed. So if it's ain't broken, we don't need to fix it. So we need to actually give people a chance to see the reason for the change that we are bringing. They should see the benefit that you're trying to give them. That principle I put out there is people must be ready for the change. And Barbara has given illustrations on how we should be able to engage the communities to actually appreciate the change that you're trying to get them into. And that's a principle that we should have at the core of getting community voices involved. The other point was around people must be involved in a change, and people must be surrounded by models of change. And I'll continue to give examples from my one project, which was that ICANN project. So you could move to the next slide and see how they apply these principles. So this was an agriculture project, and the technical team, usually when we talk about SBC, they take long to appreciate what we can bring to the table. So for the first year of the project, they went out with knowledge and skills and services, and they had all these things put out. And they believed if the inputs, people are trained, people love money, people should be able to earn a living. So basically, people will practice what we are promoting. So that was the assumption. And results were focused on numbers, how many people have been trained, what other inputs have been provided. And that was the assumption they had in the first year of the project. And when they didn't see the results, they go on to call us, which is the next slide, Tyra, to say, what can SBC do for us? And I think what we bring on the table, and this is how we get to have community voices really are critical in all this that we do. So we're able to bring in the missing piece. Yes, the inputs are important. Access to services is important. Access to knowledge is critical, and skills are critical. But then we have to bring in behavior science. And behavior science, what does it bring for us? It's basically create that demand. Let us resolve resistances that people might have. Things like, it's not my problem, it's too much risk, why should I get involved in this? We need to create that sense of commitment. And then we also wanted to see social acceptance. Everyone is doing it. People want to see that benefit and group benefit. So there's trust, which is critical. And that leads to a long-lasting change. And that brings up sustainable behavioral change and uptake of the practices. And this is what the project applied across for the coming years, and we're able to come up with things and engagement around the communities. The next slide demonstrates how, well, I'm still going on with stories. So again, I want to bring out another story, that when we actually go out there, when we went out there with that in mind, we thought, we picked stories and we said, let's have stories. Let's have a place where stories are told. And this was, again, from an insight that I picked from my grandmother, Janet, the late Janet Nsibambi. She could tell stories. She was a nursery school teacher, and she could tell stories. And within stories, it was a safe place. It was a place where we saw change. And if it was your discipline, it was addressed through stories. So, we thought it would be critical that if you want to create, let's create conversations. Let's move away from having our messaging very restricted, but let's have a messaging that creates conversations. Let's create that safe place where people articulate their views and needs. And that goes back to see how you work with teenage girls. How do you work with adolescents? How do you work with the men? Do they have a safe place where they can talk and have conversations and articulate their views? And this was an insight that we picked in this project, and we applied it a lot. So you could just have the next slide and see how did we actually organically go out to create these conversations. So we had a step-by-step process, and we started off by mapping the influencers, and that was basically a critical thing, that we could profile and have influencers mapped out. Then we could go ahead using the influencers, working with the influencers, mobilize communities to come and have dialogues and community dialogues. From that, we could be able to get them to look at what do they think they're vulnerable and what does change look like for them? What do they want to see? What is resilience to them? And they could define it in their own terms. We could also go ahead and say, what do you think are the potential shocks in your community or in your village? What do you think are those potential shocks that could happen? And the discussion could go further to say, how would you plan to address those shocks? Then they could go out and try and implement what has been discussed. And they had their own mechanisms of saying, this is how we shall track what we are doing. And then we would go back and do a lot of look at the resilience review and say, how good are we and how do we stand? I'll share a couple of slides again if you move forward on how they were able to see that from their lens. Please. So from those discussions, people came up with what they call a dream village, a dream area. This is a Karamoja region. And they said, if we actually have food security, that would mean that we're resilient. If we practice wash practices and we have people not doing open defecation, then we'd have a really clean community, we'll be resilient, we'll be safe from diseases. If we participate if everybody here is able to participate in our community activities, that would be critical, and that would be able to make sure that we are in agreement in what we're doing. If our children go to school and attend school, then they'll be different from us. They won't be having the experiences that we are having. Then they had another thing which was around income generating activities. I think if each home would have 2 income generating activities, then definitely resilience will be achieved within our communities. And this was defined by the community, and they said we can do 5. And that was a voice saying all of us are together with this, and we can do 5. So we can do 5 became the cornerstone, or the foundation on which all programming was done for that activity. You could move forward. Within that, they also framed what they called cross-cutting social themes and said, what would it mean for us to be resilient further? And they said it would be critical for us to be self-reliant, over-dependence on outsiders. We have, for food, we get food from outsiders. For everything comes from outside. How about us being less dependent on outsiders? That will make us self-reliant. Then about those something around collective responsibility, that we're in all this together, family, community, and district. Then the code for joint decision-making. What does it help a family to earn money from agriculture? Then the husband goes out and drinks all the money. So there was something around joint decision-making at all levels, at the household level, but then outside the community level, then also at the leadership level, at the district level. Then there was a call for model leadership and accountability. You're working with groups, people are going to save money. What if the money is lost? You want to have the leaders who are accountable, who speak your voice. So that was something they put out, said we need to have provide recognition and proof of progress for reflection. And they say we need the leaders to be accountable. And that was something critical for them on their road to resilience. Next slide, please. So from that, they were able to come up with what they called public commitments and showcase what they actually believe in and say, if we achieve, if our children go to school, we shall come and do some stones. They invite people to make commitments in community dialogues. And this was a way of saying, let's move forward. You can move to the next slide, which demonstrates more on this example. So people were putting up stones, and they were simple stones. These were monuments of commitment. They call them monuments of commitment. We have achieved this, we are committing to do, we can do 5. So there were 5 hats which were put out in the different villages. And it was a local way of doing monitoring and evaluation, because for each thing achieved or committed to do, they could go out and put out in the stone, and a household head would go and say, I also commit to take my child to school. I commit to plant a fruit tree. I commit to have a kitchen garden. I commit to have a washing facility. So those were stones of commitment or rocks of commitment. In other regions, in Chigezi and Nacholi, they went out and said, we shall plant a tree, a fruit tree, in case we commit to do something as a community. So each home could say, I've planted this pawpaw. Means the pawpaw tree means that I have a kitchen garden. It means I have a washing facility. It means I've taken my child to school. So there were about 5, and you could see those 5 trees coming up in the different home states. But this was something that came from listening to community voices. What does commitment look? What does progress look like them? What does progress look like for them? Number 2, what does M&E or monitoring and evaluation look like at the community level? And this was a local way of them doing it, and it was easier to track. You could move over to the next slide.
Okay, just noting a 1 minute warning.
Okay, so you could jump this one. I've already talked about the Uganda 5. Just move to the next one. So I had to just show a couple of results from where the communities were able to drive commitment and look at what they achieved. So farmers aggregating produce, and this was something they committed to, where they had 68% in a trade region, and they were able to have that come out that way. Then they had the different practices. That slides just show that while we had commitment increase, then we were guaranteed of some behavior change coming across. And this was in the different regions. You could just show the next slide for the next region. This was Acholi, and this was Karamoja, and the last one was for Chigezi region, and they just showed what it means. The last slide, which I'll run through in 30 seconds, are the implications that we can take out from this discussion, is that sustained change thrives in an environment where participants are empowered to have critical thinking skills and solve problems beyond inputs and technical knowledge. The second point was innovations are created by communities, such as the monuments that I just shared. The last point was ideas that come from the community and took on and have benefits that go beyond social behavior change, such as the plant of fruit trees that celebrated achievements. So they had a nutritional aspect which was being addressed. Thank you very much.
Thank you so much, Kenneth, for all of those great insights. And for our final presentation, last but not least, our speaker is Paul Odeke. He comes to us from the Social and Behavior Change Activity in Uganda, where he acts as a senior technical advisor. So over to you, Paul.
Thank you, Tyler. Good morning, good afternoon, and thanks to the previous speakers. I think they mentioned very crucial points and they make my presentation a lot easier. I'll try not to repeat myself. So I work with the Johns Hopkins Center for Communications Program, who is the prime partner running the Uganda Social Behavior Change Activity. So I'll give perspectives from a partner who is not entirely local, but working with audiences and putting the audience at the center to try and address social behavior change issues. So you can go to the next slide, please. So over the years, we've seen SBC evolve. Next slide, Tyler. From IEC, where information was pushed down, to BCC, where we evolved to doing lots of radio stories and dramas, to SBCC, where we began identifying that social needs have to be addressed as well. And then to SBC now, where the last C, the communication is a bit silent, given that communication isn't enough to shift the needle. You have to do a couple of other things. And the more rising need for us to focus a lot more on the S in the SBC, which is addressing issues to do with social norms and the structural issues around beyond just pushing the behavior. Next slide, please. So an organization like CCP that is global has been around for quite a bit and has implemented in various countries and has been exposed to lots of tools. So there are lots of tools out there to do SBC or to facilitate putting the audiences in the center. I just want to make a point here that we need to look out for synergies on how these tools can work together to address the audience needs, as opposed
Paul, just a quick request maybe to speak a little louder. Some of the participants are having a hard time hearing you.
Sorry, can you hear me now?
Yeah, a little better. Thank you.
Okay. Yeah. So just putting at the back of our mind that we don't have to design intervention based on the tools we have. I think that's one of the biggest killers of innovation, and brings about a disconnect between the audiences and the implementers. So even if stuff has worked out well out there, we need to contextualize and first understand the audiences before applying these tools. And we ask ourselves some questions sometimes, whether how many of these tools have been actually either suggested or have come from the communities that we serve. Next slide, please. So I'm sure we know this process. I just want to emphasize the importance of following the process. I know in this era of pandemics, many of us have skipped some of the processes and left the audiences behind just because we need to rush and intervene to curb outbreaks. But we always need to involve the audience at every step of the way as we design and implement. Next slide, please. And at SBC, we'll try and do that using the SBC flowchart. And that's what I'll hinge on while I'm explaining how we do that. So the define phase, I think the first speaker spoke about participatory action research using action media. We've done that quite a bit. And then journey mapping to understand the audience a little bit better and come up with those audience profiles with both psychographic and demographic characteristics, and also on the side of the service providers, we've used the ecosystem toolkit to try and understand the service provider, because they also live in an ecosystem and they're just like any other audience. Then working with the community to do some quiet improvement, because quiet improvement has always been done on the service side mainly, but there are lots of ways to do quiet improvement at the community level using the IDEA methodology that wears gender and social inclusion lens to tease out insights from the audiences. And of course, appraising existing interventions. I mean, people have been doing SBC for quite a while, so just going in, start from scratch, that makes sense. So it's also important as you're going to understand the audiences, you appraise existing interventions and even those within the community themselves, what's working, what's not working, before we propose intervention. Next slide, please. Just to give some highlights of what came out from some of these audience engagements. I mean, they help get to the root cause of the problem and tease out those deep audience values and norms, and help us describe the real owner of the change, who is most affected, who are the real influencers. Because sometimes we are quick to just say political leaders or cultural leaders are influencers. Depending on the theme, yet there could be other real influencers, like could be a close patriarchal uncle who is influencing males. So this helps you get deeper to that level, and also having a shared vision of the problem together with the community, just like the previous speaker said, and also kickstarting the design process of developing interventions. The first prototype that really came up with came from the audiences themselves, and then we worked together with them to bring them to life. This is just an example of alternative antenatal care that we got from Karamoja, that came from audiences that clearly highlighted that the audience had their alternative healthcare, yet we are pushing them to go for antenatal care. So addressing just knowledge issues or access issues wouldn't solve the problem if you didn't get down to the root cause of why they're actually not going for antenatal care. Next slide, please. Then using theory to try and overlay the emerging insights across the various levels is really important, so that you don't miss out on the social structural issues at the service level, the policy issues. Because I mean, if you just address issues at community and behavior level, and their issues are not addressed, there's going to be a lot of relapse or wastage of resources. So using theory that helps you have a bird's eye view, so that you can point the right partner in the right direction, try and address their issues and collaborate with them, so that you address the audience needs in a wholesome manner, is really important. So, I mean, and here I just want to mention that there is no, the best theory is really the one that you come up with. So that I mean that we have to come with theories that are really global, and then just dump them on the communities that we're working with. There could be a theory that works well for the community that you can develop based on the intervention. Next slide, please. So designing with the communities, I can't emphasize this more than the previous speakers. This is just an example of us working with adolescents to develop a game for a new campaign we're designing called the Bold campaign. But yeah, just working with them all the way obtaining feedback from them during pre-tests, and then continuously iterating until you get it right, and not without fearing of discontinuing if you don't get it right. Next slide, please. So we've designed a couple of interventions through these processes. This is just highlighting some integrated campaigns that we've designed. Just to mention that most of the audiences mentioned from the insights that they're really swamped by very many things, even from the private sector. So, and health was coming about fourth or fifth amongst the things that are salient to them. So bringing salience to health issues, and also addressing the audience needs in an integration manner was very important. So most of the campaigns were integrated. The family health integration campaign, HIV has lots of intervention areas, and TB across their cascade, but the campaigns are integrated, and a couple of others. So integration is really key in addressing the audience needs in a wholesome manner. The next slide is just showing the sample of a TVC that we did from the COVID days. I don't know if we could play. That really weaved in insights from the audiences. Tyler, could you play?
I remember the lockdown, when the streets were empty and our lives disrupted, when businesses closed and our livelihoods hung in the balance. Markets closed, taxis stopped, borders packed, hospitals were full. We lost loved ones, jobs, and hope. Our children couldn't study anymore. We cannot let this happen again. We should not go back.
Get fully vaccinated against COVID-19 and join millions of Ugandans who are already vaccinated. Obulam, a message from Ministry of Health and USAID.
Yeah, so yeah, the audience began the original prototype of this product, and that highlighted lots of issues that wanted to come out, including it being in a storytelling form. It's not attacking the audiences directly, but showing those who have gotten vaccinated and the benefits they are getting. That's speaking to pluralistic ignorance, and making sure it's emotionally charged and speaking to those emotional hot buttons, because the previous wave had really hit the audiences quite hard. Next slide, please. Then, of course, implementing with the audiences every step of the way. Next slide. Community entry is key as you go into to roll out the interventions that have been designed. Not just dropping out of the cloud and you start intervening. So a cascaded goal of entering, right from the district level to the sub-county level to the village household level is very important. And working with the various audiences to prioritize the development challenges, as opposed to just dropping your health issues just because you have targets or objectives from the boardroom. So, I mean, some communities we went to, their major challenges were around land and insecurity, yet we are being pushed to Uganda address HIV issues. So creatively, we've working out how HIV could affect their other development issues and linking the two, and acknowledging the issues that are prioritized before HIV is important for the acceptance or the involvement in fighting the issue at hand. And of course, we are working leaders to own the drive and implementation. Many times, some leaders are laid back or they are part of the problem. I mean, if you're addressing things like GBV and the leaders are practicing GBV in their own homes, it might be difficult to really solve the issues in the community. Next slide, please. And then keeping the right audience mobilizer refreshed and equipped and deployed. So also many times, like in Uganda, there are standard people who are really recommended to do the mobilization, like the village health teams. But sometimes you find there are gaps in there. And then depending on the audience insights, the audience might have not mentioned that BHTs are really their influencer. They could have mentioned someone else. It could be a popular guy at a transport stage that other people listen to. So identifying the real influencer and equipping them to really do the engagements is really important. And also treating the influencers as an audience as well, addressing their values, clarifying them, and then ensuring multiple touch points, because sometimes you just engage them once and leave them to fly on their own. Next slide. Then it's really important to, I saw Kenneth presenting some profiles of villages to really profile the audiences for precision targeting, as opposed to just going out to engage audiences openly. So we use the household profiling tool that really has indicators beyond just health, but looks at the other structural issues as well to identify priority households for intervention. And then the audiences have told us that sometimes they engage, the mobilizers just come once and disappear. So we utilize a tool that really allows repeated engagement of different households, and allows for the mobilizer to solicit commitment from the audiences to ensure that they really commit to doing the desired behavior, adopting the desired behaviors at the next visits. And then the audience is linked to services immediately. Point of contact service provision is key. It cuts out lots of structural barriers between the home and the facility. And then integration, like I said, is very key. The next slide, please. And then making health issues salient, like I said, some audiences, ranked health like fifth amongst the priority issues. They find health boring. And then sometimes when you bring things outside their usual community engagements, they really shun them. So we've utilized the existing platforms like the community meetings they hold, so their land issues or their security issues, and we weave in ways of them discussing health issues. Like on the far left, you see community meetings of heads of households and their peers, and then bring salience to ANC issues using localized baby showers, and these have attracted really young pregnant women who never used to come for natal care and were judged at the facility, and they're used to really showcase a health worker, a midwife who has better attitude now, and so we bridge that gap. And then translating the interventions into local folk that the OD agencies relate with, and gamification that attracts the men and the young people. Next slide.
Just in the interest of time, Paul, perhaps we could go to the takeaway slide so we can have
sure.
a couple minutes for Q&A. Thank you.
Yeah. Okay. So yeah, just key takeaways, not to repeat myself. We need to keep tabs on all determinants beyond just behavior and just the individuals, having that bird's eye view across all the levels, and then identifying points of synergy between the relevant SBC tools and interventions. We need to design intervention based, we shouldn't design intervention based on the existing tools, but first design interventions, then develop tools to address those, to facilitate those interventions. And then we need to address audience needs in a wholesome manner. Integration is key. It's also important for the community to troubleshoot and prioritize their own development challenges and solutions. I think we skipped a slide where we had the community scorecard where the audience defined their own success and measured it, demystifying the boardroom dashboards. And then utilizing local existing community platforms to sustain the change, as opposed to coming up with new ones, and then appraising how well interventions are implemented before wishing them off. I mentioned that earlier. And they also need to increase the community's involvement in managing some of the structural issues. Like in Uganda, we have the health unit management committees that have communities giving feedback about how this health facilities are serving them. Thank you very much.
Great. Thank you, Paul. And thank you to Barbara, Kenneth, and Paul. I'm just going to come back together now for a couple minutes of questions and answers. I feel free to add any questions into the chat if you have them. Otherwise, I would love to hear sort of as a general thought from any of the presenters, you know, how you've resolved some of these differences in the past between funders' priorities and, as you've all noted, the priorities of the community. Perhaps an example or a methodology that you've come to be able to do this. Let's see, Paul, Barbara, or Kenneth.
Sorry, if I say that again.
Just how, perhaps an example or how you've worked around the differences between a funder's priority and then the priority of the community, how you've worked through that and been able to come to a solution to meet both needs.
Yeah, so I'll give an example. We were tasked to go to Karamoja to try and push the 95-95 agenda of HIV, which is really finding the HIV positive clients and get them tested. But when we got there, their priorities were really the bit of insecurity in the region, and I think some land wrangles, and HIV wasn't really on their mind. So sitting down with them to try and first of all prioritize what are the development challenges, and then really finding ways of highlighting how things like HIV could escalate the problems of insecurity, and also highlighting the burden of HIV through their local personnel, like the local biostatisticians in the area, showing how many are really dying, how many are not really going to work and graze their cattle when they're bedridden. So they may lose their cattle when they're bedridden. So yeah, just working out ways of bringing salience to the health issues, almost to the level of the insecurity and the land wrangles, and really work to ensure that they pay attention to the development challenge at hand. But then also being honest and giving feedback to the donor on of course using data. Donor usually listens and is a little patient as opposed to just pushing for targets to be met.
Yeah, thank you for that, Paul. I think we can all relate to yeah, many of the things that you said in your response. So we are at the hour. Like I said, we will be sending out the presentations as well as the recording, as well as I think the SALT approach that was shared. Feel free to add any other helpful resources in the chat that you think would be useful for other audience members. But otherwise, thank you everyone for attending. And of course, a huge thank you to Paul, Barbara, and Kenneth for your excellent presentations. A lot of great reminders and insights and examples that I think, you know, we all understand and remember and then sometimes forget, like one of you said, especially sometimes during some of these health emergencies. So I think all of the reminders and insights and examples were fantastic. So thank you all for joining, and be sure to tune in for other Springboard events in the future. All right, thank you all and have a great day.
Thank you. Bye-bye, everyone. Bye.
Thank you very much.
All right, bye.
Thanks, bye.